Hi, it's Dr. Andy. Quick video here because my nephew asked me a question, and so I wanted to respond to that. So Dallin, sorry I'm a little slow to respond on your question you sent a few days ago, but the question he had was, why is it that with high transmission rates we need to wear masks? He said, I appreciated the last video and I'm starting to be better at it, but I'm having a difficult time explaining why that high transmission rates makes this difference. So the key thing here, I think, and is that really the focus here, it's not so much on preventing us from getting it, and that's really the whole benefit of the masks. It's more to prevent us from spreading it. And one of the reasons that I think maybe sometimes we have a little hard time understanding this is because we're so often thinking about, well, how do I protect myself? What's good for me? And this is really a question not of individual health, it's a question of public health. So the issue is that even people that are vaccinated can contract the disease still, and since they're vaccinated, they're less likely to have serious disease. So it's even more likely that they could have an asymptomatic or mildly symptomatic case of the disease, but still be spreading it. Now, the chance of getting it is lower, and I know I've stressed that over and over again. If you get the vaccine, the chance of getting this disease is lower, but you still can get it. And so when the rates are really high, that's when we kind of we elevate our efforts to tamp it down. And so in those places where the rates are really high, even those people that are vaccinated, they say, even though the chance that you have it is less, we really need to work hard. So we want to make sure that you are not spreading it to people around you, particularly those that are unvaccinated, because they're the ones that are more likely to get it and more likely to get more significant disease from it. So that's really the key. It's not an individual health measure, it's a public health measure, and so that's why the public says rates are high in this area, so we recommend that everyone in these public indoor places wear masks, and in addition, those that are not vaccinated wear them in more than just public indoor places anytime that they're going to be near other people, essentially, from outside their household. So that's kind of the key. Like I said, it's just us getting used to the idea of not just our individual personal decisions, but about being in it together for our community. And that, like I said, we live in a society that's very individual focused, which is great. There are a lot of great things that come out of that, and a lot of great things that have come out of our society because of that. But sometimes we have a harder time understanding public measures and measures of social benefit in some ways, just because we may not think at that community level as frequently as some societies do. Now, so bottom line is, when those rates are high, we all should be doing what we can to prevent spreading it, and that's one of those measures. There you go, Dallin.